Assalamu alaikum. I am Shamama Batul Mughal of Group 19. The topic which was assigned to us is myocardial infarction. I am covering use of beta blockers in myocardial infarction. So, what is myocardial infarction? It is an ischemic heart disease in which there is an abrupt cutoff of the blood flow to the heart, resulting in the damage to heart muscles. The blockage is usually due to buildup of plaque, a substance made up of fat, cholesterol, and cellular waste product. What are the causes? Mostly, the leading cause of myocardial infarction is the sudden blockage in the coronary artery due to the formation of thrombus. It may form in a coronary artery that already has been narrowed by atherosclerosis. The symptoms include pressure, a feeling, tightness, and aching around the chest and arm area that may spread to your neck, jaw, or back. Nausea, indigestion, heartburn, or abdominal pain. Shortness of breath. The patient also feels fatigue, lightheadedness, or sudden dizziness. A lot of medications are there to treat the condition of myocardial infarction. First of all is the aspirin. Aspirin reduces the blood clotting, thus help in opening the pathway for blood flow. Thrombolytics, these drugs help to dissolve the blood clot that's blocking blood flow to your heart. If they are administered earlier in a heart attack, the greater will be the chance you will survive. The next are the antiplatelet agents. Platelet aggregation inhibitors help to prevent new clots and keep existing clots from getting larger. Nitroglycerine, this medication used to treat chest pain, angina, can help improve blood flow to the heart by widening or dilating the blood vessels. Beta blockers. These medications help relax your heart muscles, slow your heartbeat, and decrease blood pressure, making your heart's job easier. Beta blockers can limit the amount of heart muscle damage and prevent future heart attacks. ACE inhibitors. These drugs lower blood pressure and reduce stress on the heart. Statins. These drugs help control your blood cholesterol level. Now we are heading towards the case study. Mr. FG is a 69-year-old retired school teacher who was admitted to the emergency department complaining of severe chest pain after climbing stairs at his daughter's house. In the ambulance, he is administered aspirin 300 milligram. On arrival at hospital and subsequent examination and review by the admitting doctor, the following information is obtained. Previous medical history, hypertension 10 years, type 2 diabetes mellitus, recently diagnosed, currently diet controlled. The patient is a regular cigarette smoker greater than 40 per day and drinks approximately 10 units of alcohol per week. He has osteoarthritis of the knee. Now we are solving the case study with the help of SOAP notes. And for that, subjective is chief complaint severe chest pain, age 69 years, gender male, history of patient hypertension 10 years, type 2 diabetes mellitus recently diagnosed. He has osteoarthritis of the knee. Current medication, allergies, trimethoprim. Mr. FG has been taking diclofenac MR tablet 75 milligram twice daily and nifedipine adult retard MR tablet 20 milligram twice daily. Both were stopped on admission. Objective. The vital signs were temperature 36.4 degrees Celsius, blood pressure 160 by 80 mmHg, heart rate 75 beats per minute regular, respiratory rate 15 breaths per minute, no basal crackles in the lungs. Lab reports, the sodium levels were 134 millimole per liter, potassium 4.3 millimole per liter, urea 5.2 millimole per liter, creatinine 81 micromole per liter, total cholesterol 5.9 millimole per liter, blood glucose levels were 4.4 millimole per liter. An ECG was also taken immediately on arrival, reveals ST elevation of 3 mm in the inferior leads. Assessment. A preliminary diagnosis of myocardial infarction is made. As the patient is complaining of severe chest pain, it is highly indicative of the blocked blood supply of the heart. The patient has been given immediate therapy with aspirin to cope with the initial symptoms of the heart attack. Patient is also suffering from hypertension since 10 years. Thus, there is a strong possibility of elevated blood pressure levels. Mr. FG also has been diagnosed with diabetes mellitus recently, but his lifestyle consumption of alcohol, smoking is showing that his blood glucose levels might be not in control range. And we know that high blood sugar levels can be a cause of heart attack. The plan. Pharmacological treatment. There is a strong evidence that beta blockers can reduce mortality by up to 23% post myocardial infarction. Beta blockers should be used to reduce the risk of further cardiovascular disease events, irrespective of whether the blood pressure is raised or not. Beta blocker, which is well tolerated and that can be taken once or twice daily, should be used. Atenolol, bisoprolol, or metoprolol are suitable agents. For atenolol, the dose should be 100 mg daily in 1 or 2 divided doses. Bisoprolol, usually 10 mg daily up to a maximum of 20 mg daily. It is usual to start at lower doses, example 2.5 or 5 mg, and then increase the time. Metoprolol, 50 to 100 mg 2 to 3 times daily. For hypertension, he should take any blood pressure controlling medication like ACE inhibitor or ARBs, etc. If ACE inhibitor, then he should use captopril in dose of 6.25 mg BID. If ARBs, then he should take losartan in dose of 50 mg QD. He should also strictly monitor his blood glucose levels to avoid any complication. If it can't be controlled with diet, then he immediately start taking insulin or other blood glucose lowering agents. Non-pharmacological treatment. The patient should stop consuming alcohol completely because it affects the health of heart very much. He should also quit smoking as it is very injurious for heart. Moreover, he should try to live a healthy lifestyle, should take healthy and nutritious food, should not intake oily foods, and should do light exercises daily. Thank you.